program Roadway to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower you about health-related matters. Today is Tuesday, April 28, 2026, and driving you through this edition of the program are Angeline, Noah, and
Benedolly.
So however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, as I say always, like and share the live stream, invite a friend to watch along with you. And to our dedicated radio listeners, it's always good to be here with you. Stay with us as we have another beautiful package for you. Well, we'll take a moment to send special greetings to the Minister of Health, Dr. Louis Porto, her able deputies, assistant ministers, and all of the staff at the Ministry of Health. We'd like to say thanks in a special way for your continual commitment to shaping the health agenda of our country. As I stated previously, we have a beautiful package, and Benedolly is here. She will be introducing our guests, after which we'll bring you the topic. But before then, we'll take a very short break to be back. Welcome back and thanks for rejoining us. And so we now join Benedolly to introduce our guests and bring us our topic for today's discussion. Good morning, Ben.
Good morning, Angeline. I'd like to say a pleasant good morning and it's good to be back. So for today, our guests on the program, Roadway to Health, we have Mr. Anthony K. Betty. He's the Director for Neglected Tropical Diseases Program at the Ministry of Health. And we have Dr. Casa K. Colley. He's the Senior Program Advisor for Effect Hope Canada. And we have our female, our beautiful female, that's Mrs. Tawusu Bidan. She's the Coordinator Schistosomiasis and Urogenital Schistosomiasis at the Neglected Tropical Diseases Program at the Ministry of Health. So you guys are welcome. And the topic for today on our discussion is schistosomiasis, most especially a neglected tropical disease affecting rural communities. So welcome. In general.
Thank you very much, Bendu. So with that said, we will join our guests to have them talk to us, give us their first words on the program before we go into our discussion, beginning with Mr. Colley. Good morning.
Good morning. So,
Dr. Colley, I'm sorry.
Yes.
Good morning.
No problem. So like the introduction was done already. My name is Dr. Kasapon. As a matter of fact, I worked with the ministry before as director. So
I was about to say.
so nothing is very strange for me right now. But I work for Ife Hope. I've been seconded from the Ministry of Health. And Ife Hope basically is an NGO based in Canada that's been working for the past 130 years supporting leprosy and neglected tropical diseases, and has been working supporting the Ministry of Health since 2012 to now. And we're pleased to be supporting the Ministry of Health at this moment, specifically on urogenital schistosomiasis at this point. Thank you.
Thank you. Welcome. Mr. Betty.
Thank you very much. My name is Anthony Kepler Betty, Director for Neglected Tropical Diseases Program at the Ministry of Health. I've been with the Ministry of Health since 2008, and working with Dr. Casa Colley, who I replaced.
And it's good to see the both of you working together this time.
Sure.
Okay.
Okay, good morning. My name is Mrs. Tawusu Bobodan, and like you said, I am the coordinator for schistosomiasis and urogenital schistosomiasis, and I've been with the program since 2021, and I've been from one level to another, so I'm happy to be here. Thank you.
Okay. So we are talking schistosomiasis today, but with focus on urogenital schistosomiasis. You know, bringing spotlight on the impacts and what we are to do to prevent it and what we are doing as a country and all of that. But before we go deep into the discussion, let's give a background of this schistosomiasis, because I hear schistosomiasis and then I hear urogenital schistosomiasis. I'm like, are we talking about the same thing, or is there a difference? What exactly is schistosomiasis? How is it different from urogenital schistosomiasis?
So thank you very much. Schistosomiasis is one of the neglected tropical diseases that affect the populations who live in rural community. In 2012, Liberia did a mapping for schistosomiasis, and it's endemic in 13 of the 15 counties, with the exception of Grand Cru and Riverside County. So since then, we have been implementing mass drug administration for schistosomiasis. But specifically coming to urogenital schistosomiasis, that affect also both female and male reproductive organs, which is a gynecological conditions that is caused by the complication of schistosomiasis, which is a parasitic worm. But they have various types of these worms. We have the Schistosoma hematobium, which have caused urogenital schistosomiasis. And then we have Schistosoma mansionis that also affect the intestine, but that's not our focus. Our focus is actually on Schistosoma hematobium that is causing a complication for women for female genital schistosomiasis. We have male and female genital schistosomiasis. The one that affects the male is male genital schistosomiasis, and why the one that affects the women is female genital schistosomiasis. So in Liberia, we have been managing the schistosomiasis since 2012, but we did an assessment in Bong and Nimba County for female genital schistosomiasis only in Pantakbai and Saclay Mine, where we were able to identify 256 women, and those women were also treated. But out of those women, we have 18 women who were pregnant, and the medicine we gave, which is a prazocontin, we do not administer it to pregnant women. So based on that, we have been working along with partners to see how best we can address the issue of urogenital schistosomiasis in Nigeria.
Why does it affect people in rural communities only? And then I keep hearing you saying urogenital schistosomiasis. Why is that urogenital attached to the schistosomiasis?
So when we talk about urogenital schistosomiasis, it affects the reproductive organ of both male and female. So in women, it affects the cervix, while in men, it also affects the prostate. So all these are reproductive organs of the human being. And why people in rural areas, the disease is connected to people who live near water or swamp, who are engaged in swamp farming, and then the disease is caused by the infected snail, those small snails that live in the water. So it's the habitat for the disease. So people who are engaged in this kind of activity, fishing, bathing, more especially children, school-age children from 5 to 14 years, women of childbearing age who are engaged in fishing activity, washing clothes. So when they get in the water, they get infected with the worms. It penetrates the skin. It also affects the bladder, and as a result, they develop the disease.
But before you come in, you said worms and then you said snails. Which one actually causes schistosomiasis?
The worm live in the snail.
Okay.
So the air live in the snail, and then it's been released in the water. So when you get in the water, you get infected with the disease.
Okay, so if you are just tuning in, this is the program Way to Health, and we are here talking on schistosomiasis with emphasis on urogenital schistosomiasis. Okay, so Angel, you know this schistosomiasis is something that we see it maybe in the rural communities as a common thing, right? Because in the rural communities, we go to the creek and we go to the lakeside to say we're going to wash, but now we have a lot of things there. So we want to know some of the signs and symptoms when you come in contact or when you have already contacted with schistosomiasis. Dr. Colley?
So it's important for us to clearly understand that the manifestation of schistosomiasis is the urogenital schistosomiasis. That means, simply people will say, the complication of schistosomiasis. If you get schistosomiasis, if it is not identified and treated early, it could lead to what we now refer to as urogenital schistosomiasis. And like the director said earlier, there are two. It affects men. It also affects women. When it affects men, they call it male genital schistosomiasis, and the female is called female genital schistosomiasis. So in terms of the signs and symptoms, specifically for schistosomiasis, is since we are talking about the species that cause the urogenital schistosomiasis, is the hematobium that affect the urinary system. Normally, the most classical sign most people will look at is at the end of the urination. You want to urinate, it comes with blood, called the terminal hematuria. That's one sign. In women, it will cause pain when you're having sex. It comes with other discharge. It can be very painful. When it comes to the urogenital schistosomiasis, the signs and symptoms are similar to sexual infections, STIs, sexually transmitted infections. And then because of that, a lot of people misdiagnose. As a matter of fact, this disease, this condition we're talking about is quite new. It has been discovered not too long. A lot of information is still not very available, especially for the one that happens in men, the male genital schistosomiasis. So a lot of research that we are engaged in to really see how it affects men. At the moment, we know clearly that we've done research in Liberia that clearly show that we have a lot of female genital schistosomiasis in Liberia. So in terms of the signs and symptoms, those are classical ones. There are some that we can't, and we will be telling you probably on the complications. If you have urogenital schistosomiasis, nothing is done, what will happen?
Okay, so all right, so Madam Dan. All right, so the signs and symptoms, blood in urine. All right, so what UGS, right? Urogenital schistosomiasis is dangerous.
Okay. So like they already mentioned some of the signs and symptoms. It's dangerous because the first thing is we know that health is important to every one of us, and once you are not completely healthy, then there's a problem. So it's dangerous because if it's untreated in long term, it tends to affect not just you peeing or urine, stuff like that, but it starts to affect even underlying organs like the liver. So it's dangerous because you also have stigma attachment, and we know that once someone is affected with such a disease and they are not treated, they face stigma. They also go through social economic issues, because if you are stigmatized and you are afraid to go into your normal or your daily basis routine, you will have to face some social economic issues because you can't go among people, you cannot go to the market, and then it becomes a burden not just on you but on your family and the community. So it's a dangerous disease because it affects our underlying organs like the kidney, and they mentioned that women face female genital schistosomiasis. So you start to have bladder cancer in long term if you are not treated. So it's a whole big problem. So it's dangerous. If we don't treat it, we face not just health impact, we also face socio-economic impact. Excuse me. Yeah.
So, you want to add on?
Yes, so I just want to add, just as you said, one of the major focus in terms of the complication when you have female genital schistosomiasis is infertility. It will cause women will not have children because of, and like she also said, it goes along with a stigma when women cannot born or a woman cannot born as a result of certain sickness. We know about certain how they are perceived. So I know Betty will tell you more about when we did a study in Liberia and Bon County, the experience with how women being stigmatized. Some of them, their partners left them just because they had female genital schistosomiasis. But after treatment, I mean, they have their own stories to tell. So basically, that's one very key. But the fact that also you have complication in terms of the infertility, that's also an issue, like I said earlier. But the pain also experienced during intercourse. So there are several, and in men that also happens. It also causes infertility in men because it destroys the organs. More importantly, one thing we need to also remember is that this disease predisposes us or whoever is affected to HIV and HPV, human papillomavirus, that leads to cervical cancer. So the way that occurs is technical, but what we need to do here is to pass on the message that if this disease is not identified early and treated, it can predispose the female to HIV and other sexually transmitted infections.
Yeah, so we firstly did our research in Liberia in Bon County where we got it confirmed. The schistosomiasis, where it was first confirmed. Is that so?
So we Betty earlier told you that the distinction is schistosomiasis. The hematobium leads to urinary genital schistosomiasis. So the first survey we did in Liberia was around 2012 onward for the entire country to see where we have schistosomiasis.
Okay.
So having done that, we decided now, since we uncovered that there is another complication that results from schistosomiasis, we decided to do a small survey in one district in Nimba, another district in Bon County, to see the complication of that schistosomiasis that we're discussing today, which is urinary genital schistosomiasis. So that was what we found in just 2 districts. He emphasized on the number, about 256 cases that were identified and treated. So this condition is serious, and we do not know at the moment the entire country, the breeding for the entire country, and that's what you want to say.
Exactly.
So that's part of our next steps. I know my colleagues will be talking about.
But have you tried to find out if this is happening in other counties?
So to come in, as we said earlier, the data we got from the 2 districts is limited to, over the whole country. So this is the reason why, because of the lack of multi-sectoral framework to guide the Ministry of Health in managing urogenital schistosomiasis, the ministry, along with the partner, now decided to develop a strategic plan that would direct the ministry in the control and management of urogenital schistosomiasis. So that's why we developed the urogenital schistosomiasis strategic plan, which runs from 2026 to 2030.
Okay, so we'll talk about the plan later, right? Can we do that? Yeah. Okay, we can go in depth later when it comes to the plan after talking about the different things connected to the urogenital schistosomiasis. Pedro, you want to come in?
Yes, so for doing the Collie explanation, he said there was a survey of the whole country. So someone listening will want to know probably if there are specific counties. There are specific counties that you did your survey in, came up that this county have so and so amount percent of this people or people living with this.
So I'll leave that with the director.
So, thank you very much. When the survey was conducted in 2012 to 2015 in the 15 counties, so as I said earlier, we have 13 counties that had schistosomiasis, but we have 4 of these counties that had a higher prevalence above 50%. So one of those counties is Bond County, Lofa, Maryland, and Nimba County. And then the rest of the county had less than 10%. So although we treat there, but we treat there after every 2 years. But those 4 counties require annual treatment. Every year we need to treat those counties, both school-age children and adults with praxicontia to control the schistosomiasis. And as we talk about schistosoma hematobium, those counties also have high prevalence of the disease. Like where we did the research, Sagle-Piedmont had a prevalence over almost 80% prevalence. So almost the whole population in that place affected. And then Pantac Bay. So, and then it's divided by the St. John River. So that's why we did the research there. And then we got to find out that, a lot of people were affected with female genital schistosomiasis and they were treated. So based on that, we are trying now to see how we can move all around the country to make sure that we do a burden assessment to see whether the UGS exists in other counties.
Okay, so in these counties, right? So how is the treatment is about?
So on an annual basis, we've been supported by partner and then the World Health Organization to conduct a mild drug administration with praxicontia, which is a tablet, the drug of choice to treat schistosomiasis, both hematobium and Masonite. So we work along with the county health team, the community people select their own people from their own community to give this medicine annually to their people from house to house. So as a means of control. So another part of the control is also the control of the snail. There we are lacking, and then we can also wash, because if you have safe drinking water and people are not going to infected water to to draw drinking water or bathing, I mean, a control also reduce the prevalence of the disease.
All right, so in short, to help eradicate or prevent schistosomiasis, we should enforce snail.
No, not really.
No. There are very small, tiny snail in the water, not the snail we eat. So those tiny snail in those creeks, even when you are making a swamp farm where they lay the bomb between there where the water running, those are the area that those snail live, and then they live there and become infected. And people who doing swamp farming, as I told you earlier, women who go in, go fishing, bathing, like children bathing in the water. So those people get infected with the disease, but it's not the snail, the big snail we eat.
Yes, it was just done for clarity because. All right, so
I just wanted to add that the snail that is referenced is the intermediate host. That means it comes from something before we get to the snail, and then the snail too send it all into the water, and then when you get into the water, when you are exposed to the water, that's when you get infected with this parasite or parasitic worm. So the prevention in other places will be to depopulate those type of snails. Part of it is also to use protective clothing when you are getting into environment like that. Normally it's the water that is stagnant and not the running water, not where you see like a river. We don't there's no breeding site for schisto or those kind of the snails in those kind of places where you have a running water. But areas where you have like a lagoon, like areas, those are the places where you see the snails can be, and then they get infected, and of course they harbor the parasite that causes this disease. So if you want to prevent, that prevention is in multi-dimension. It's not just about killing snail. It's also about ensuring that you are not exposed to the water that is infected.
So, February 27 of this year, the Ministry of Health, through the NTD unit and its partners, I'm sure IFETHO was fully part of that process, launched the Urogenital Schistosomiasis Strategic Plan 2026-2030. I stand to be corrected.
Yes.
And that also marked Liberia as the first African country to launch strategic plan on urogenital schistosomiasis.
Sure.
Anyway, congratulations to the team. But tell us, in a very clear and concise way, what's in that plan? And when we will start to see implementation of the plan?
Okay, so like you said, the plan was launched on February 27, 2026, and that strategic plan is the Urogenital Schistosomiasis strategic plan. So that plan incorporates everything that we intend to do over the next couple of years from 2026 to 2030. And in the development of that plan, we took into consideration the ministry's framework or building blocks. So the mission is actually to ensure that we provide quality, equitable, timely, and trusted urogenital services to people using the person-centered approach. So in the plan, we want to ensure, like they mentioned, about the control of schistosomiasis is not just a one-sided control system. You have to be able to collaborate with different sectors in order to ensure that you can effectively and efficiently control schistosomiasis. So when they were talking about the prevention, they mentioned not just the PZQ that you give to the mass drug administration, but you have to control the sinew. And then we also need to control the defecation, that open defecation aspect, where people go to urinate and to toilet in the water. So that's why we have the water sanitation and hygiene wash coming in, that we can also be able to provide pits or latrines for people to use, so that the water is not also exposed to the parasite. But even more so, to be able to provide quality and equitable services, you will need to have tools that you will use to do that. So in that strategy, we have a lot there. But over the next couple of months, 18 to 24 months, we want to be able to firstly generate the evidence. What's the distribution of female and male genital schistosomiasis within the country?
Okay.
We want to be able to generate that evidence. We have capacity gap. So one of the building blocks talk about service delivery, but we cannot deliver effective and efficient services if we do not have the capacity. So we want to be able to develop training tools, diagnostic tools that will be used to provide those services. So my colleagues or my bosses will actually speak further, but we actually need to generate the evidence. We need to develop algorithms for diagnosis. We need to develop training tools, SBC materials, and all of that to be able to effectively provide those services. Thank you.
How do you intend to go about with the evidence generation?
So thank you. We are planning first to do a burden assessment in the various county, like the way we did the mapping for schistosomiasis, and then but that will be done at the health facility level, and also we will do some qualitative assessment in the community or interview women. So that is the first plan of action, and then from there we start to develop tools and then train health worker, because as Dr. Polly told you earlier, this condition is very new, and then you have a lot of health workers who are misdiagnosing this case with sexually transmitted infection because the signs and symptoms look the same. And so we need to train the health worker at all levels, from the community level to the national level. So midwife, doctors, community health volunteers, physician assistants, nurses, doctors, we need to train all of these people to make sure that we can be able to manage UTS properly.
She also talked about the people-centered approach.
So we also working through the One Health platform to manage these diseases. So we are members of that platform. Okay. So we will be working directly along with the community people, the people at the health facility, the district, and the county.
Okay. Dr. Colley, you want to add up?
So from the partner perspective, what we've been doing is to provide technical support to the Ministry of Health, and also financial support for the development of the strategy. We want to also appreciate Only May Health, one of the organizations that also supported the process of developing the strategy. But as we move forward in terms of the next step, IFEHO is mobilizing resources. We already have signed contract with the ministry for the next 18 months to 24 months, like 2 years, to see how we can lay the basis to support financially.
Okay.
To see how we don't want it.
No, we like that.
We don't want the plane to go and be under the decks and the dust is getting on it. So we are moving very fast with this. As a matter of fact, we want to thank the Ministry of Health for taking the lead globally. Liberia is the first country to develop a strategy in this term and to start implementing. In other countries, it stays fragmented and people don't even know how to approach it. So Liberia is in the lead when it comes to urogenital schistosomiasis. You can research that, you see that.
Saw that.
Well, so basically, our role is to provide technical support and financial support as we speak. So we have available resources right now that can carry the ministry for the next 18 months.
Wow.
We've based on the plan that they've had.
All right. So speaking of the strategic plan, are there some area of priorities that NTDs is focusing on?
So the strategy was developed based on the building block of the World Health Organization. So we look at leadership and governance, human resources, I talk about training, capacity building of health worker, service delivery, and then essential medicine supply. That's very important because even if we get all the funding and then we don't have the medicine. So presently we are working along with MEC, responsible to produce the process content to make sure that we get medicine to treat the people. So, and this medicine is very expensive, so that's why we are talking to them to make sure that it's being provided free of charge to the affected population. So, we also work with the health information system because data collection is very important in this situation. So we have to make sure that we get quality data, infrastructure. So we have to make sure that the women also have privacy when they get to health facilities, and then monitoring and evaluation is also important. So those are some of the priority area for the strategy, and then based on the priority, we develop an operational plan for the next 24 months to make sure that we start activities that will address issues concerning men and women who are affected with urogenital schistosomiasis in Liberia.
So you heard our team song from the beginning of the program. Our health, our life is in our hands, and to make it better, we need to work together. So that means it takes, collective effort to achieve certain things when it comes to health. So let's talk about the role that communities play in ensuring that we have a successful fight against urogenital schistosomiasis. I mean, we see that it affects reproductive health as well, both in men and women. So we might want to look in that direction. What role do they play as well?
So thank you very much. It's not only the neglected tropical diseases program that is actually going to be in charge of this situation. So we have various partners and departments within the Ministry of Health who are also members of the Urogenital Schistosomiasis Steering Committee. So we have the Family Health Division, mental health, because we told you it also causes mental problems, psychosocial issues. We have the nursing division. We also have HIV/AIDS control program. We have other partner and agency in Ministry of Education, because schistosomiasis, we're talking about school age children, so we will be maybe treated in the school. So Ministry of Education is also involved. We have the WAS Commission. So various departments within the Ministry of Health, as I said earlier, are also involved.
So okay.
So basically, just to add to what he said, the coordination mechanism put in place as you go through the document is quite unique, and it's probably first of its kind in terms of how to coordinate. When you talk about UGS, urogenital schistosomiasis, most of it is, the focus right now is on women. You expect that this whole project is seated in the reproductive health department instead of the neglected tropical disease. That's how it is globally.
Okay.
But the Ministry of Health, along with all of the programs came together and said they want entities to be at the secretariat. And then it's been coordinated, and that's the description the director was just giving. But more to that, you talk about the community. The community, from what I saw from the initial stage of the development of the document, you saw people affected by the disease, and we are part of the development. They have a say into how this whole process is going to take place at that level. Then you have community health assistants, you have people from the community themselves being part of how the whole activity is going to be happening. So for what I see, I think it's a very good plan. It's not just something done by the national level coming down, but you have community full participation. And thankfully, the Ministry of Health has a really unique community health structure within the health system that link to service delivery and stuff like that. So yes, more importantly, you saw that I just emphasized on how people who were affected at that time, the 256 persons, some of them were part of the development of all the materials that will be used for the control and the management of these cases.
Okay, so we're about to open the phone line to have our listeners participate. But before we do that, Mr. Betty,
Yes.
January 21st of this year, you were selected from a pool of 105 applicants as a member of the Expert Advisory Group on Urogenital Schistosomiasis. First, I'd like to say congratulations.
Thank you.
So I want to know, what does this seat mean for us as a country?
So I think it's a plus for Liberia, based on our experiences over the year. So the World Health Organization, specifically AFRO, was looking for expertise to advise them on urogenital schistosomiasis control and management for the next 5 to 10 years. And then they put out this vacancy application, call for application, and then we apply. As you said earlier, we were like 105, and I was lucky to be selected among the 105 to serve on the 14-man committee to advise the World Health Organization on urogenital schistosomiasis in Africa. So it's just an advisory committee. We meet 4 times in a year, But other people saw it, so Anthony get a job with WHO. No, I stay at the Ministry of Health, but we meet as a technical committee to advise the World Health Organization and other partner on the management and control of urogenital schistosomiasis in the world.
I just told you,
More
like,
especially in
Liberia is leading in too many
Exactly.
areas. You know that when it comes to urogenital schistosomiasis, Liberia is the. I just told you about how Liberia is the first so Liberia is an expert when it comes to urogenital schistosomiasis. So a lot of countries will be learning from what we do in Liberia.
Yeah, thank you for securing such seat on that national platform for
International platform.
International platform. So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. And we're e-talks this morning from the team from the Neglected Tropical Diseases Unit, collaborating here with Ifet Hope, represented by Dr. Colley, and we are talking urogenital schistosomiasis this morning. You've been listening, you've heard all of the discussion, or we've been talking. To be a part of the discussion, ask questions, make reports, or whatever you pointed down that you want to understand about urogenital schistosomiasis, you can call us on 077-5677-376, 077-5677-376, 088-0514-096, 088-0514-096 are the numbers to call. Call us this morning and be a part of this discussion. Ben, how do you feel knowing that we are leading as a country when it comes to the fight against urogenital schistosomiasis, being the first country to develop strategic plan and then being selected among 105 applicants to be a part of an advisory group?
You know, it is a good thing, right? Because it will also boost the health sectors, most especially because if Liberia, it's not really if, but Liberia has been chosen and was selected, right, to be on that seat, and our director was there, and it shows that in Liberia being the first country to have launched the schistosomiasis. So I think our neighboring countries as well we have, because according to what Dr. Cody said, he said other countries are maybe stagnant or still in a gap, don't want to launch theirs. But looking at Liberia launching theirs is a good thing for us, and we know that 100% the Ministry of Health, we're going to do their best. We will, and we will do our best.
Okay.
We have call, right?
Okay, let's take this first now. First caller. Good morning.
Good morning.
Your name and where do you join us from?
You have insufficient credits. Please recharge.
Please recharge and call.
How am I hearing this? 077-5677-376, 077-5677-376, 088-0514-096. Please recharge and call us back. We'd love to hear from you. 088-0514-096, 077-5677-376 are the numbers to call. Call us and be a part of this discussion this morning. 088-0514-096, 077-5677-376. So let's take this person again. Good morning.
Good morning.
Please walk away from your radio.
Yeah.
Your name and where do you... Yes, go ahead.
My name, Jenny. Hello?
Yes, I'm hearing. Go ahead, Jenny. I hear somebody say Kopo. Jenny Kopo. Where?
Yeah. My question is, if you want to be tested, where can you go to be tested for the disease?
Okay, thank you very much. Good morning.
Good morning.
Yes, your name and where do you join us from?
Yeah, my name is Jerry Wayne. I do call from District Number 1, Liberia County.
Let's hear you.
Thank you for the platform. I really appreciate big still guests like you never on our water issue. Speak to you, my mother, who in Bon County. That's something was playing there, rather. It's in the water. If I was go fishing there, you want a quart. So I said, I just spell a shoe that I had a disease, but being into it, don't know. So there need to be more awareness and more publicity with the viral diseases and towns so that they can be aware of that genital syndrome. Thank you for the show.
Thank you very much. 08805140996 is 07756777376 are the numbers to call. While we wait for more calls, Dr. Colley, we can start to respond to the first set of callers concerned.
Okay, so I will start responding in the initial response. Let's go.
Let's say this person. Good morning.
Good morning.
Good morning.
Where do you join us from? Walk away from your radio now.
Am I clear now?
You are clear, but you need to walk away from that radio.
Is it better?
Go ahead.
Yeah, my name is Eric Owaflo Bayi Jr.
Okay.
And, I'm a PhD. I'm also a candidate, Commonwealth District. And I listened to the presenters. They did extremely well presenting the topic. But I understand that the presentation focused more in the rural area. And my youth will live in one area and similar activities, some of those activities that go on in the rural area also happens in the urban area where people are involved in fishing, going on water fishing. And we've been aware that schistosomiasis can be found in water and some of those things are also in the urban area. So my question here is, are they only considering the rural area as in the urban area? Thank you.
Thank you very much.
Thank you.
07756777376 08805140996. Dr. Colley.
So basically, we start. The first question from Janet is, if you want to be tested, where do you go? So at the moment, we just started this whole urogenital schistosomiasis. But when it comes to schistosomiasis, the first thing, you don't even want to wait. When treatment is given, the mass drug administration for schistosomiasis, you take advantage of it. If you take the medicine against schistosomiasis, you can be rest assured that you have prevented the urogenital schistosomiasis. So, and I can also advise you, besides just this condition, any other condition where you see yourself having any signs and symptoms of something that you don't know, you go to the nearest health facility, they will be able to advise you. But the plan the ministry is making, as we will be supporting, will include how to position some of these tests in various health facilities, health promotion materials, to support how they can develop training materials for medical doctors, physician assistant nurses, and the rest of it.
You care to include the ages eligible for this medication you are talking about for prevention?
So for the medication we give from 5 years and above, so children below 5 years old do not take the medicine.
Okay.
But the WHO is trying to see how they can develop pediatric prazoquintal that will also be used for children below 5 years. So that process is in, and then the trial have gone in some country, but for Liberia we don't have that yet.
Okay.
And to just buttress what Dr. Colley said, so if anyone is having the disease, the best place to go is the hospital, and then you can do your lab test. If you have schistosomiasis, we'll be able to treat you.
There were other concerns confirming that, yes, this disease is very found around water. Someone called talking about morsinails and other things. You want to just speak to that a little?
So thank you. What's the last caller? So why we focus on the rural area and not the urban area. So schistosomiasis is a disease that is focused. And coming to the urban area more, especially in Monrovia area, it's likely to see the diseases in most of the water here because the water we have is salty. But we're talking about freshwater creek that, but places like Bonkande, like the river right in Banga, is infested with a lot of schistosomiasis. So the rural area, most of the fresh water, there the snake live, is their habitat. So you will find more people in the rural area affected than the urban area. But somebody can be affected from the rural area and move into Monrovia and also affect water maybe in places like Todi. You see?
So basically, I think to just add to what Betty said, this is not just a rural area disease. People can be affected and move to another place too. That is why we are doing a breeding estimate. By the time you do the breeding, the survey, you know clearly which areas you need to focus in terms of your intervention. And that's what Betty said, the disease is focal. I mean, it can, even in one county, it can happen to certain part of the county, it wouldn't happen to other parts of the county. And that's the essence of doing the assessment.
This question is very important. Can this disease be transmitted from one person to another, considering that you get it into your county, they say that you can get rid of somebody?
The way the disease is transmitted is if someone from the interior have the disease, and then you go to a water and then defecate in that water and you have the snail, so the air is move into the snail and affect the snail. It grow in the snail, and then the snail release what we call the sicaria, that's the worm, into the water. So when you get there, it penetrates you. But it's like for you to make myself know, you have to get in the water, or maybe somebody with Schistosomiasis and defecate in the soil, and then the air is still viable, and then you step inside, it may be penetrated.
So it's not transmitted directly from person to person,
Okay.
and not even through sexual intercourse.
Okay.
Yeah, we have many calls, but we can't take any more calls because we are out of town. So we just hear your parting comments, and then we can close it for today. So we will begin with ladies before gentlemen.
Okay. So I think this was an informative time. We're happy to provide information to the public. So any knowledge that's not translated into action is of no use. So as you have listened to all of what we've said, I ask that you become champions of change in your various community, and also just give awareness to those who need it most.
Okay.
Thank you.
Thank you very much. Firstly, I would like to thank the Minister of Health, Dr. Luis Mputu, and all the Deputy Minister for giving all the responsibility to manage the neglected tropical diseases program in Liberia that is affecting millions of people. And we will work along with our partner to make sure that we put these diseases under control. And we have a plan by 2030 to at least eliminate one of these diseases, which is lymphatic filariasis from Liberia. Will be joining other countries, in which we are almost on the path. We have stopped treatment in 9 of the counties, and pretty soon we'll be stopping treatment in other counties when we do our transmission assessment survey and notice that people don't have the disease. So thank you very much.
Okay, Dr. Colley.
And on behalf of the partners that are supporting this program, we want to also extend our thanks and appreciation to the Ministry of Health for the collaboration we've had over the years, and just to reassure the ministry that we are here in a long-term partnership to provide our financial and technical support as we move towards fighting these conditions in Liberia, not just the FGS or the female genital schistosomiasis. And to the public, this disease can be prevented, and it can also be managed if it is identified. So when you have any issue that you don't understand yourself, it's good to go to the nearest health facility. Thank you very much.
Okay, thank you very much. Bendu?
All right, from my end, I'd like to say thanks to our studio guests. Until then, I'll see you next Tuesday. Bye-bye from my end.
Okay, urogenital schistosomiasis can be prevented, but early detection matters. So if you are unsure about anything you are dealing with, go to the nearest health facility where you can get your answer. With that, this is how we'd like to leave you on today's edition of the program, Roadway to Health. Many thanks to our guests, Mr. Betty, Dr. Colley, and our beautiful lady seated right there, for sharing such valuable insights this morning. We have been your hosts, Angelina and A.B. Salif and George have been here taking us live. Until next Tuesday, have a good day.